call, though, have been saying that the suggestion, and this meeting's with Nadeem Zahawi, who was a business minister now in charge of vaccine rollout, is that the new Tier 4 areas that will be put into that top tier, that will come into effect from the 26th of December, so from Boxing Day. So I think that clears up one crucial point, that there may have been worry in some of these areas that if Tier 4 was brought in overnight tonight ahead of Christmas, then that would have destroyed Christmas plans by getting rid of the, albeit limited, Christmas bubble where 3 households can mix just on Christmas Day. I think it will also prompt questions, though, that if the situation is grave enough in these areas to move them into Tier 4, which would suggest this new variant of coronavirus has taken hold in a worrying way in these areas, is it really responsible to let people mix indoors for one day before essentially locking those areas down? I suspect the answer will be the politics of telling people for the second time within a week that they have to readjust their Christmas plans again may just be too difficult for the government. But I think we'll expect to hear the precise areas from Matt Hancock when he's up speaking from Downing Street in the next 10 minutes. Perhaps those areas going into Tier 4 confined mainly to the southeast and potentially areas connected to existing Tier 4 regions. So I think places like Norfolk, maybe filling in the gaps in areas in Essex and West and East Sussex, which are currently in a lower tier when neighbouring areas, even of that county, are in the higher tier.
We'll return to coronavirus in just a moment, but can I divert our attention to talk about Brexit and mumblings of a potential deal today? I mean, we're wary, Rob, aren't we? Because we've heard this before. Where are we?
Yeah, there's been a sort of will they, won't they going on for, well, I'd say days, probably weeks now. But there does appear to be noises coming out from the Brussels side of this. The Reuters news agency are reporting an anonymous senior EU diplomat saying that a UK trade deal is imminent and it may come as early as today. Now, nothing back from those involved in those negotiations on the UK side yet, but when we heard from Robert Jemrick, the Community Secretary, this morning, he was very much downplaying any chance of a breakthrough. That has sort of been the default setting from this side of the channel, though. Every time talk seems to bubble up in Brussels around the hope for a deal, it's quickly slapped down by the UK side. Now, it's difficult to say how much of that is the UK calling it as it is, or potentially trying to manage expectations. We know the final sticking point, and it's what's been a sticking point all the way along, really, over fish. And essentially, they need to come to a compromise over what access the EU retains to UK waters and how long the transition to that new access goes on to. We know that Boris Johnson has been speaking to the European Commission President Ursula von der Leyen on and off for the last 2 or 3 days. Those conversations haven't been briefed out in the way that we expect them to be usually, which suggests that maybe this is an ongoing sort of dialogue about the negotiations that are going on at a technical level between Michel Barnier and Lord Frost. But really, deadlines have come and gone. We had that deadline of, 10 days ago, Sunday, a week ago. That came and went. Then we had another European Parliament deadline that was set, saying that they wouldn't be able to ratify and vote on the deal in time for the end of the transition. And that was last Sunday. All of those have come and gone. There seems to be some sort of suggestion of another Christmas Eve deadline. Frankly, at this point, I'm very wary about talking about any deadlines because, as we know from the last 3 or 4 years of Brexit, deadlines that can seem hard can go decidedly soft the closer we get to them.
I suppose all we can say with any certainty is that the transition period ends on December the 31st. But even this week, we've had calls for that to be extended, rejected by the government. If a deal is agreed, what then happens in order to get it through, Rob?
Well, I think what we will probably see is a recall of Parliament here in Westminster, which realistically, I don't think you'll see MPs sitting on Christmas Eve or Christmas Day. That will probably happen in the period between Christmas Day and New Year, the end of that transition period, to put through any necessary legislation that will take that international treaty that will be agreed with the EU and put it into domestic law. There have been alterations, if you like, made to some of the processes in the House of Commons to allow more people to participate virtually if they can't make it back to the Commons, because obviously, partly because of COVID procedures to keep people safe, to make sure there's not too many people in the chamber, but also partly, obviously, it's not the most convenient time to expect people to come back. In terms of the European side, they've already been pretty clear that there is not enough time for the European Parliament to ratify this deal, which would leave a number of options. It would leave probably the most likely that would be to bring in the treaty, bring in that trade deal and the future arrangement on a sort of pending status, pending the ratification of the European Parliament. Another option would potentially be to have a temporary period of no deal. I think that seems less likely, though, because if we've got to this point where actually a deal has been thrashed out, even to have a matter of days or even a matter of weeks of no deal and the disruption that would inevitably cause, I think would seem pretty pointless.
Yeah, so there's an awful lot going on for the government over this Christmas period. We are waiting to hear from Matt Hancock, the Health Secretary, in the next couple of minutes. We understand he's going to be on his feet in the next few minutes to give that update on those Tier 4 restrictions. And as we were saying, Rob, likely to be further areas, particularly those that are already bordering Tier 4 regions, that could be going into the toughest level of restrictions. And the signs are that these restrictions are not going to be eased anytime soon.
Yeah, I think if people were expecting to have press conferences anytime soon saying that areas were moving down a tier, well, I think they will be disappointed. What has changed the context of this is the emergence of that new variant that government scientists believe is 70% more transmissible. And I think what will be really playing on the minds of ministers and public health officials is some of the concerns we've heard even today from scientists about whether actually Tier 4, lockdown measures essentially, whether that is enough to keep a lid on the spread of this new variant. Obviously, at the moment, schools are off, so you've almost got in the Tier 4 areas a sort of Tier 4 plus, because you don't have children going into schools. And what we heard from Neil Ferguson, a prominent epidemiologist, this morning was that the next couple of weeks would be pretty crucial in seeing whether cases do still escalate in those Tier 4 areas despite children being off school. I think if it goes in the wrong way, and we have seen some really scary rises in case rates in the past few weeks, it will leave the government with an incredibly difficult decision about what to do about schools come January. We know already that secondary schools will be staggered. They will be going back for a majority of students that aren't in exam years anyway, a week later. Now, that's to allow a sort of mass screen of secondary school students using rapid turnaround tests as they come back. And I think the hope is after the Christmas period, maybe a sort of mass vetting, a mass screen like that might be able to avoid the type of spike at the start of term that we saw back in September when students went back. And I think what we are also waiting for, as well as keeping an eye on the case rate, is the result of some work and an investigation that is going on at the moment to find out whether this new variant is more easily spread by younger people, by school-age children. We know that the balance of harm that has been essentially conducted by the government and by scientists over the past 9-10 months is that actually the damage done to the future livelihoods and the education of children by keeping them out of school, when compared to the risk that the virus poses to them, actually it is better for them to be in school in a COVID-secure way. I think what ministers will be adding up over the coming weeks is whether that balance starts to get tipped in one direction if this new variant is found to be more prevalent amongst children. Because I think the real worry, and what we may see play out in the coming weeks, is whether these scary rises in case numbers are mirrored, whether the percentage rises are mirrored in terms of hospitalisations and then in terms of deaths. We know work is going on to establish whether this new variant affects people in a more serious or less serious way. The indication so far is there's nothing to suggest it would affect them in a more serious way. If it is in a less serious way, that might mean that actually the rises in cases are not mirrored with the hospitalisations and the deaths. If they are, I think come January we could be in a very difficult position given the number of cases we've seen and the case rate increase we've seen in the coming weeks, and given that in large parts of the country there is going to be mingling on Christmas Day, which inevitably is going to push up case numbers further.
We heard from Professor Neil Ferguson and others speaking to the Science and Technology Committee earlier on today, Rob. Professor Ferguson talking about an increase in the number of under-15s who have the new variant of the virus. In fact, I'm just going to stop there because here is the Health Secretary, Matt Hancock.
Good afternoon and welcome to Downing Street for today's coronavirus briefing. And I'm joined by Deputy Chief Medical Officer Jenny Harries and Dr. Susan Hopkins, the Chief Medical Advisor to Public Health England and NHS Test and Trace. We all know that 2020 has been a hard year, and it's ending in this festive period, which is going to be very different. After all the efforts that we've gone through to control this virus, and in many parts of the country, this virus is under control. Just as we've got a tiered system in place that was able to control this virus, we've discovered a new, more contagious virus, a variant that is spreading at a dangerous rate. And I know that the vast majority of people watching today and across the country understand what we need to do together to get through this. And so today we're announcing further action within the tiering system and also some further progress on vaccines and on testing. And I just wanted to say this before I set out the details of what we're going to have to put in place. I know that these actions have consequences. I know how difficult it is, but I also know that it is right to take the action that's necessary to control this virus. Across the country, cases have risen 57% in the last week. The average COVID hospital admissions are 1,909 a day. That's the highest figure since mid-April. There are 18,943 people in hospital with coronavirus right now. That's almost as many as there were at the peak. And yesterday, there were 691 deaths reported. That's 691 people who have died just before Christmas. And our hearts go out to their families, their loved ones, as with all who've died from this horrible disease. I know the pain that this causes. So against this backdrop of rising infections, rising hospitalizations, and rising numbers of people dying from coronavirus, it is absolutely vital that we act. We simply cannot have the kind of Christmas that we all yearn for. Of course, it's the social contact that makes Christmas so special, but it's that social contact that the virus thrives on, and that's how the virus is spread from one person to another. So it's important that we all minimize our social contact as much as is possible this Christmas, and that will help protect ourselves, our loved ones, and the whole country. We've got to keep our resolve. We've got to keep going through this. And there's 4 areas that I want to update you on today very specifically. The first are those tiering decisions that I just mentioned. We know that the 3-tiered system worked to control the old variant and is working now in large parts of the country, especially in northern England. But we also know that Tier 3 is not enough to control the new variant. This is not a hypothesis, it is a fact, and we've seen it on the ground. We've seen case rates rise in some of the places close to where the current Tier 4 restrictions are, in places like East Anglia, where we've seen a significant number of the new variant, and we've seen case rates rise sharply. It is therefore necessary to put more of the east and southeast of England into Tier 4. We're also taking action in parts of the southwest, where there are some early signs of the new variant and where cases are rising. Even though case rates in some of these areas are not as high as they are in the areas badly affected, in London, for instance, and in Kent, the direction is clear and in many cases quite stark. The doubling times are short. And we have learned that when it comes to being a matter of when, not if, we take action, it is better to act sooner. So from 1 minute past midnight on Boxing Day, Sussex, Oxfordshire, Suffolk, Norfolk and Cambridgeshire, those parts of Essex not yet in Tier 4, Waverley in Surrey and Hampshire, including Portsmouth and Southampton, but with the exception of the New Forest, will all be escalated to Tier 4. Bristol, Gloucestershire, Somerset, including the North Somerset Council area, Swindon, the Isle of Wight, the New Forest, and Northamptonshire, as well as Cheshire and Warrington, will all be escalated to Tier 3. And I'm afraid that Cornwall and Herefordshire have seen sharply rising rates and need to be escalated to Tier 2. This is not news that anybody wants to deliver, and I am truly sorry for the disruption that it causes. But I think people know how important it is that we take decisions like this to keep people safe and to protect the NHS. The second piece of news I want to tell you about is some developments about another new strain of this virus. Of course, the fight against the virus is a global effort, and we're constantly vigilant and looking around the world. And as part of our surveillance, and thanks to the impressive genomic capability of the South Africans, we've detected 2 cases of another new variant of coronavirus here in the UK. Both are contacts of cases who have travelled from South Africa over the past few weeks. The Chief Scientific Advisor and the Chief Medical Officer and others met their South African counterparts over the last day, and we are incredibly grateful to the South African government for the rigour of their science and the openness and the transparency with which they have rightly acted, as we did when we discovered a new variant here. This new variant is highly concerning because it is yet more transmissible and it appears to have mutated further than the new variant that's been discovered in the UK. We've taken the following action. First, we are quarantining cases and close contacts of cases found here in the UK. Second, we're placing immediate restrictions on travel from South Africa. And finally, and most importantly, anyone in the UK who has been in South Africa in the past fortnight, and anyone who is a close contact of someone who's been in South Africa in the last fortnight must quarantine immediately. By quarantine, I mean they must restrict all contact with any other person whatsoever. We'll be changing the law to give this legal effect imminently. Now, these measures are temporary while we investigate further this new strain, which is shortly to be analysed at Porton Down. And I want to thank everyone involved for the seriousness with which I know that they will take these new instructions. I'd like now to move on to some more positive developments. The third thing I wanted to talk about is an update on testing. As you know, we continue rapidly to expand the testing capability here in the UK. We're expanding community testing yet further in areas where the rate of infection is highest, so we can identify people, and especially identify the around 1 in 3 people who carry the virus without displaying any symptoms at all. 116 local areas have now signed up for this community testing, and we're in discussion with more. And these rapid turnaround tests are proving to be extremely effective at finding cases where we otherwise wouldn't. And I'm today publishing an assessment of the Liverpool community testing project, which shows how effective this can be. I'd urge anyone who has the opportunity to take part to protect their local area. And at the same time, we're boosting rapid testing in care homes with a further £149 million to support that effort. So all those who work in care homes in England will receive 2 rapid tests a week in addition to their weekly PCR tests. Finally, amid all of this difficulty, the great hope for 2021 is, of course, the vaccine. The vaccine is our route out of all this. And however tough this Christmas and this winter is going to be, we know that the transforming force of science is helping to find a way through. I'm delighted to be able to tell you that the Oxford AstraZeneca vaccine, developed here in the UK, has submitted its full data package to the MHRA for approval. This is the next step towards a decision on the deployment of the vaccine, which is already being manufactured, including here in the UK. We are, of course, continuing to deploy the Pfizer-BioNTech vaccine, which is being delivered now from over 500 sites all across the UK, and we're adding more all of the time and accelerating the rollout. I'm also delighted to be able to announce that we have begun vaccination in care homes. We know that people who live in care homes are amongst the most vulnerable to this disease, and I'm delighted that we're able to do this. Again, it's another enormous logistical challenge, and I'm very, very grateful to colleagues in the NHS and in the social care sector who've worked together so hard to make this happen. This afternoon, it gives me great joy to tell you that the Chelsea pensioners will be vaccinated, along with care home residents right across the country. I think we all need a bit of good news. And the reality is this vaccine programme is the way we're going to get through this. Because every time somebody's vaccinated, our country becomes a little bit safer, they become a little bit safer, and we get a little bit closer to the life that we all want to get back to. I sincerely hope that this is my last press conference before Christmas. And I want to just take a moment, firstly to thank you and everybody watching for all that you have done and the sacrifices that you've made. And I also want to thank my whole team, who've done so much, including those here, Susan and Jenny, but including the huge team in the NHS, in the department, and right across the board. As a country, we've been faced with these enormous challenges, and it's been very tough. But I especially want to thank those who helped this country to become the first in the world to roll out a clinically approved vaccine. I want to thank all those who've helped us build a bigger capacity in genomic testing than anywhere else in the world, and of course, the biggest overall testing capacity in Europe. I want to thank our scientists who've discovered the first proven treatment for coronavirus. And I want to thank everybody working in the NHS and in social care for the work that they've done this year, and also for the work that's going to carry on this winter. And especially to colleagues who are working over Christmas, which of course is so important in the NHS and in social care. Look, I know how hard 2020 has been for everybody, and after delivering some really difficult news, if I may, I want to end on a reflection of where we are as a country. This Christmas and the start of 2021 is going to be tough. The new variant makes everything much harder, because it spreads so much faster. But we mustn't give up now. We know that we can control this virus. We know we can get through this together. We're going to get through it by suppressing the virus until a vaccine can make us safe. And that's been our strategy, and that's what we must do. We're not going to give up now, especially after so much sacrifice. And I know that some of these decisions are tough, but I believe that everybody making the right decisions, and I believe that everybody will do what is needed to keep themselves and others safe, especially this Christmas. And I know from the bottom of my heart that there are brighter skies ahead. And I'm now going to hand over to Jenny to give us an update on the data, especially on the impact of this new variant. Jenny.
Thank you, Secretary of State. First slide, please. So I'm just going to talk through about half a dozen slides which highlight in graphical array the comments which Secretary of State has just outlined. And as usual, the darker colours on the maps indicate higher rates or higher rates of change. On this slide, we can see on the left-hand side that in the last 7 days, this is the last full week, case rates up to the 17th of December, They've continued to rise at a very rapid pace. This is particularly in London, the southeast, the east of England, and in Wales. And you can see that with the dark colours there, which equate to more than 400 cases per 100,000 resident population. One of the most important things, though, is not just how many cases there are, but the rate of change. And if we look to the right-hand side, you can see that the darker pink and the purple is where those changes are really starting to move more rapidly. So as expected, it perhaps doesn't show up quite as well on the slide here, but as expected, again, particularly in London, the southeast, east of England and Wales. But you can also see that the colour is starting to change through the bordering areas, particularly into Suffolk, Cambridgeshire and Norfolk, and then treading down to the southwest. Next slide, please. What we can see here is 3 lines which are representing those areas which are currently Tier 4 areas, so places like London, and that's the dark black line. And you can see that since September there has been a rise, and then in November when the restrictions came in and we had, if you like, the original COVID, you can see that starts to decline, but then fairly soon afterwards, and particularly at the start of this month, you can see an extraordinarily rapid rise in cases moving upwards. The dotted line, the purple dotted line, are those areas which are now moving into Tier 4. And you can see the same shape of curve here. What we're trying to do is identify where that rapid increase is coming, which is most likely due to the new variant. And you can see that it's a parallel line to the areas where we currently know have very high proportions of new variant in the cases detected. What's equally important, I think, is to look at the green dotted line, and these are areas in the rest of England. Obviously, a month previously, we've tended to see very dark colours at the north, northwest, northeast, and what you can see there is the rise during September, October, the November restrictions coming in, and quite a significant drop in that dotted green line. So against our old version of COVID, if you like, the restrictions had effect, and what we're dealing with now is almost two different patterns, one for the new variant and one for the old. Next slide, please. And here, this is clearer, I think, in this one. So these are cases identified, the proportion of cases which are positive for COVID-19 from November and then running in through to the middle of December. The dark purple line is cases which are new variant compatible, and the green line are the cases. So in some ways, this is reflecting the green and purple lines on the original map. And what you can see again is that the original version of COVID is been brought down from November. You can see quite a sharp decline in cases and a levelling off, but a very rapid rise in the new variant cases, which are moving forward at pace. Next slide, please. And again, if we just look at the 3 most affected areas, you can see this very starkly. The green line, again, is other cases. You can see that they've dipped from November. The national restrictions at that time brought them down. There is some rise now, but the real sharp increase, which is what we're dealing with, is the new variant compatible cases. And obviously these are the most affected areas. In other parts of England, we're starting now to see a mixed picture where the other cases, the original COVID cases, have come down, have flattened, but we're starting to see rises. And what we're looking out for is that very sharp incline in the rate of change. Next slide, please. And of course, unfortunately, this then translates through to occupied beds with patients who are COVID positive. And you can see here that the number of patients in hospital came right down over the summer period. It was rising steadily. The November restrictions have dropped that, but now it's starting to rise very sharply, almost certainly with predominantly new variant cases. And so we're now very close to the spring peak in terms of the numbers of patients in hospital. Next slide, please. And again, this is just looking in London and looking at COVID-positive occupied beds, again, heading very much towards the spring peak. You can see the flattening off in the middle of November, but now steadily increasing upwards and causing a lot of pressure. Mostly, obviously, we're trying to treat COVID patients, but every time a bed is occupied by a COVID patient, of course, we need to think through of the impact in others seeking hospital treatment. Thank you.
Thank you very much. We'll now go to questions, firstly from the public and then from the media. The first question is a video. Tim from Huddleston.
Good afternoon. I am one of the UK residents that finds themselves trapped abroad after being given little to no notice to return home. I now find myself stuck in Germany until next year. What is being done to help UK residents like myself? Thank you.
Thank you, Tim. Well, I can understand the frustration that you feel and others who are caught abroad by the measures that have been brought in to restrict travel from the UK. Now, obviously, we as the UK government want to see you able to come home, and we're having discussions with other governments right around the world to ensure that that travel can safely happen. So, for instance, you will have seen that there was an agreement reached with the French government, and also the European Union said that travel should continue, but they want it to continue, understandably, in a safe way. The problem with this new variant is that we are trying to restrict it from moving outside the areas where it is now at large, which, as you can see from the maps, is broadly the southeast and the east of England, including London. So the short answer is we're working with our international colleagues to try to get you home, Tim, you and others who are caught abroad by this. It's difficult, and we'll do everything we can to get you back. The next question is from Catherine from southwest London, also by video.
Good afternoon and happy Christmas. Given the new variation of COVID-19, will you consider a move to online learning for schools for a longer period than the 5 days currently planned at the beginning of January term? Also, will you consider rolling out the vaccine for vulnerable teachers who are putting our lives on the line to keep schools open during the pandemic? Thank you.
Thank you, Catherine, and happy Christmas to you. As you know, we've put in place a new plan for the new year to ensure that there's testing in secondary schools to keep students safe, but also to keep teachers safe. When it comes to the vaccine, just before I hand over to Jenny Harries to comment, what I'd say is that we follow strict clinical advice in terms of the order in which people get vaccinated. So if people are clinically vulnerable, whether they're teachers or not, they will get early access to the vaccine. And I think following that clinical order of priority is very important, because that's the best way to protect life. It's also the best way for us all to get through to the other side of this, because once those who are clinically vulnerable are better protected, then it will get easier for all of us. Jenny.
Thank you, Secretary of State. I'm sensing from the question that, Catherine, you might be a teacher, so it's a good opportunity to say thank you to all the teachers who I know have been working really hard, because the public health implications of children being out of school are not just now, but they are for their lives. So it's a really important environment. In terms of clinical vulnerability, certainly the evidence that we have, and we're continuing to look at that, SAGE has been looking just in the last week or so at the data, doesn't suggest that teachers themselves are at any greater risk, but clearly teachers who are clinically vulnerable will be anxious. And as the Secretary of State has said, the different groups, the clinically extremely vulnerable, have been recognised and are already in the higher risk group, alongside those who are 70 and over, and those who are clinically vulnerable, i.e. have more general conditions, but nevertheless increasingly vulnerable in the face of a new virus, are included in Group 6. So I hope that gives teachers assurance that those vulnerabilities have been considered. And obviously JCVI has looked at that independently, but we've been able to feed in much of the information and scientific evidence that we've had around different risk ratios.
Thanks very much. Thank you, Catherine. Next question is from Leila Natu at the BBC. Leila.
Thank you, Secretary of State. You've just said when it comes to coronavirus that it's better to act sooner. But the Prime Minister said on Saturday that the new strain was present across the country. Your chief scientific advisor said on Monday that it wasn't possible to stop it from spreading beyond the southeast. And you're only announcing today the widening of Tier 4 within the southeast and east of England, and only from Boxing Day. Haven't you wasted valuable time in trying to get ahead of the new strain of the virus? And if I may, to Dr. Harries, you've talked about yet another more transmissible strain being identified from South Africa. How confident are you that the new 4-tier system is strong enough to tackle that?
Thanks very much. Well, as you know, when we got the information on Friday afternoon about the impact of the new variant on transmission, that it's that much more contagious, we acted incredibly fast to put the 4th tier in place. And then today we've broadened that. There are parts of the country where the case rates, thankfully, as you saw in the charts, have been coming down. And the whole basis of the tiered system is to take a proportionate approach to the areas where we need very firm action and other areas where we clearly need restrictions, but they don't have to be as drastic. Now, added to that, of course, is everybody's personal responsibility. And that is the critical thing this Christmas and through to the new year. It is really important that people make sure that they minimise the chances of them passing on the disease, because it's actually by all of our actions collectively that we get this under control. On the new variant and the South African variant, I'm going to pass to Susan Hopkins, if I may, who is the expert on the genomics, and then ask Jenny to comment on the epidemiology. Susan.
Great, thank you. So the new variant in the UK, which we've identified, is very different to the variant in South Africa. It's got different mutations. Both of them look like they're more transmissible. We have more evidence on the transmission for the UK variant because we've been studying that with great detail with academic partners. We're still learning about the South African variant, and you've heard already the measures that we're introducing to ensure that we quarantine people who are coming in from South Africa. And therefore, we are pretty confident, actually, that the system we have in place will help control the spread. Clearly, this needs to be continually monitored, and we have a genomic system in place to do that. And we are looking at to constantly enhance the detection of cases in travellers. I'll hand over to Jenny.
Thank you, Susan. So, yes, I think going back to the tiered system, obviously, as you could see from the slides, against the old version of COVID, our original one we were dealing with, those tiering systems in Tier 3 has been very successful. The problem now is that we have very high rising rates of the new variant in the UK. And I think just generally we expect viruses to mutate. So I think this should not come as a surprise. What is obviously very clear is that the UK has a huge capacity to look at these different variants and advise at an early stage. So that's very positive. In terms of the tiering, effectively what it's doing, it's encouraging and tightening our own behaviours and helping us to keep those behaviours within the areas that we are living and working. And that actually is the most important thing. Although the virus in both these cases appears to be more transmissible, at the moment, on current evidence, the actual disease that one gets is no different. And so all of the basic measures which we are continually trying to do and which the tiers help us to do should actually prevent it. So normal things, wearing face coverings if we're with people, crowded places that we don't know, keeping our distance generally, keeping rooms ventilated, not going out when we don't need to, keeping all of our contacts down. So exactly the same interventions are the right ones, and they will work against all of the variants. What the tiers are doing are helping us with that behaviour and limiting us when perhaps we want to stray off course a little bit and we forget.
Thank you very much indeed. The next question is from Dan Hewitt at ITV. Dan.
Thank you, Secretary of State. Given the direction of travel here, isn't it now inevitable that the vast majority of the country, if not all of England, will end up in Tier 4 at some point in the next few weeks? If so, why wait for that time? Why not do that more decisively now? On the new strain of the virus, I know it's early, but is there any evidence at this stage to suggest that it wouldn't work? So the new vaccine wouldn't work against this new strain? And a very quick fact question. Could we have the latest number, please, and the number of people who've received their first dose of the Pfizer vaccination, please?
Thanks very much. So I'll answer the first and third and then pass over to Dr. Hopkins for the second question. The answer to the third is that we will be publishing tomorrow the full data on the vaccination programme so far, and we'll publish those as formal government statistics for the first time. And then we'll expand the statistics that are available around this programme on a weekly basis as we're going to publish those data weekly from now on. On the first question, absolutely we act fast, and you'll have seen from the action that we took and the Prime Minister announced on Saturday that we're prepared to act incredibly fast and take further action as we did this morning. We also want that action to be proportionate, and in the parts of the country where the number of the new variant is very low, of course we want to keep it that way, and the current tiers are working. What we've all got to do, as Dr. Harries has just set out, is we've all got to take responsibility for our own actions as well and reduce the amount that anybody might be spreading it, because of this critical fact. 1 in 3 people who have coronavirus don't know they have it, but can still spread it. And if we all act like we might have it, then that is the best way to reduce the transmission. Susan.
Thank you. So I would just reiterate that, treat everyone like they have it and we'll start to get to a better place. From the point of view of the vaccine, so we have no evidence at the moment that the vaccine will not work. So actually what that means, in fact, is that there's strong evidence that it will work, because the vaccine produces a strong immune response and it's broad and it acts against lots of variation in the virus. What we are doing is laboratory studies with people who have had previous infection and who've had vaccine, to look and see in the laboratory how their blood kills the virus. Those take a number of weeks as we grow the virus and do those studies. As soon as they're available, we will, of course, release them. We will also be monitoring the people who've had the vaccine very carefully, as we would anyway in coming weeks, to determine whether they have a less risk of infection, both of clinical infection, but also of subclinical infection, particularly in healthcare workers who are getting regular screening. So we will have both laboratory data and then clinical data in weeks ahead that will help us. At the moment, though, we have all the faith in the vaccines that we have. They produce a broad response, and I would recommend that everyone who is offered one takes a vaccine.
Thanks very much, Dan. Next question is from Rob Powell at Sky.
Hello, Health Secretary. How confident are you that Tier 4 restrictions is enough to bear down on this new variant? And if it's not, what other levers have you got to pull to try and bear down on the new variant? And to Dr. Harries as well, you've outlined some pretty stark increases in infections in recent days and weeks. Do you expect those percentage increases in infections to be mirrored in hospitalisations and ultimately deaths as we go further down the line? And if you do, what impact will that have on the NHS?
Well, Rob, in answer to your first question, it took us some time to work out the 3-tiered system, which was calibrated to keep the old variant, the original variants, under control. And we got to a point that the tiered system, the 3-tiered system, was effective against the old variants. And in fact, there's an interesting study being published today in The Lancet that tests again the old variant against those 3 tiers. The critical question is Tier 4 working against the new variant, just as you asked in your question. We have made sure that the Tier 4 measures do as much as is reasonably possible, but it all depends on how people actually behave. You know, this is a partnership. There's so much that we can do in terms of setting the rules and legislating from government, with all of the consequences that those actions have. But there's something that every single person can and should do, especially with the vaccine. Actually, I was about to say on the horizon. It's not on the horizon. It's here. It's being injected into people's arms right now. And with just the time to get the vaccine rolled out left, we should all be extremely careful about the social interactions that we have, because it is, yes, about the rules that we set in government, but it's actually about how every single person acts. And the good thing is that throughout this crisis, the vast majority of people have acted in a really responsible way. They've done their bit. And of course, it's easy to see, you know, pictures of people running for trains and what have you, but actually that has been a small minority. So let's all stick at it and not give in to temptation, and that way we'll be able to get through it and make sure that Tier 4 is indeed effective against the new variant. There was a further question embedded.
There was, I think, about case rate rises and how that translates to the NHS. So obviously you can see from the slides that that sharp rise in cases is going to need some stopping. And as Secretary of State has said, this is not something that can be orchestrated. It is something which we all have to do. And however sad a time of year it is for us to be reminded that we need to behave that way, it is a very stark reminder that we do all need to manage our own behaviours, keep our distances. I think, as I said earlier, there is no reason at the moment to suggest that the new variant will, if you like, turn into more severe disease or more deaths. But clearly, if we have more cases, then we will see rising numbers, and those numbers are rising quite quickly now. But it's not inevitable that they will. If we do all take those behaviours, to keep our distance over Christmas, limit the number of people that we're with, those numbers are not inevitable rises. And one area where I think it's important to highlight, obviously care homes and the elderly are areas where we have seen very significant rates, sadly, of deaths before and serious cases. There are significant measures in place now, and Secretary of State has obviously highlighted this afternoon that testing is going in urgently in response to these rising case rates. So I think with all the hard work which the care home staff have been putting in, and the residents themselves, of course, in quite difficult circumstances, there are opportunities for us to ensure that these cases do not just automatically translate through into hospital cases.
Thanks, Rob. It's on us all. Jane Merrick at the Eye. Hi, Jane.
Hi there, thank you. To the Health Secretary, first of all, you said that Tier 3 is not enough to contain the new variant and that it is spreading at a dangerous rate. And across the country, hospital patients is at the peak in spring. Nerve Tags said this morning that the new variant has seeded across the country. We're now hearing of a second new variant from South Africa. So why aren't we going into a full lockdown across the whole country? And if I could ask the medics, Neil Ferguson of Nerve Tag said this morning that there is a statistically significant, albeit small, evidence of an increased proportion of infections among the under 15s. Is there a case for mass testing in primaries and perhaps a staggered return for primaries as well as secondaries?
Thanks very much, Jane. So the answer to the first question is that the new variant is highly concentrated, and the stay-at-home rule in the east, the southeast, and London is aimed at keeping this new variant from spreading across the country. And that's why we've taken the approach that we have in terms of the tiering and expanding the number of areas that are in Tier 4. On the education question, I'm going to ask Susan to answer on the virology, and then Jenny to answer on the question of the consequences, especially for schools.
So firstly, we have no evidence that this virus is more transmissible in children yet. But what we do know is that when this virus took off, the children were one of the few things that were happening at the end of the last national restrictions that was still happening and mixing. So it was more likely that the transmission could start in that place. And I think we have seen that especially younger age teenagers have seen a higher number of infections. There's much less infection in primary school children, and we've seen that throughout the pandemic to date. And we will constantly take decisions with the experts in education over what is best for the children along with controlling the virus. And I'll hand over to Jenny to add some more.
Yeah, just to add to that, I think, as Susan has said, if we look at historically, if we're going back a few months now, at what happened when we had very significant rates of the original variant COVID virus in the north, we did see rises in cases in children there, but they were very much lower than they were in the adult population. They did rise quite steeply in teenagers, and I think we do know that there is transmission, but as Susan has said, it is generally lower as you go down the age groups, and it is extremely difficult to untangle what the children are doing. So there is perhaps an assumption that if children are at home, they won't transmit disease, but we have to be really clear that that is the case. Schools are very controlled environments in many cases, and so we know what children are doing there, and it's very difficult to disentangle, for example, what a child is doing in school, what a child is doing at the school gates, or on the way to school, or in their community. So I think education is really important for children, and we shouldn't jump to the conclusion that just because every child is in school, that is a significant place for transmission. And as Susan has said, there is a lot of work ongoing and continuous studies to try and understand this in a little bit more detail.
Thank you, Jane. Merry Christmas. Next question is from Sam Lister at The Express.
Thank you, Secretary of State. With the Oxford vaccine on the brink of being approved and 100 million doses on order, how soon do you think you'll be able to stand before us and say that the vast majority of the British public have been vaccinated and this virus is beaten? And how many people do you expect to be vaccinated before Easter?
Oh, Sam, you're so tempting. I really want to have a stab at the answer, but the truth is we just don't know. It depends on the speed of manufacture. I'm really thrilled that the full data has been passed to the regulator, and I have every confidence that the regulator will look at it with great capability. I want to put no pressure on them in terms of the decision or the timing of the decision. It is absolutely a matter for them. But then we've always said that the vast majority of the vaccinations will be in the new year. And I think that our vaccination program started before most people expected it to. We've made really good strides over the month of December so far, and we will go as fast as we possibly can. This will be a big task for the NHS. What I would say in terms of the number of people vaccinated is that I think we will get there by the spring, that people should therefore just hold on and really try to resist temptation to do things that they shouldn't and to see people that they don't need to. And I know that that is tough and it's going to be a tough winter, but the more people do that, the more quickly we're going to get through this together. I wish I could give you a more direct answer than that, but we just aren't there yet. The true answer will be as fast as we possibly can. The final question from Arj Singh at the HuffPost.
Hello. People are pinning their hopes on the vaccine allowing a return to normality in a few months. But Professor Stephen Evans of the London School of Hygiene and Tropical Medicine suggested this week that the UK wouldn't be able to get back to normal until half the population had been vaccinated. And there are some suggestions that might not happen until 2022, unless rates of the virus are very low. Given the emergence of a highly transmissible new variant, has the government overpromised yet again in suggesting that Easter could mark a return to normality?
No, I'm highly confident that we'll get things back to normal before 2022, based on the speed at which we can roll out the vaccine. Not least because it's really important that the speed of rollout of the vaccine is accelerating. All the time we're adding more places to where the vaccine is being deployed from, and so we're accelerating the pace of the rollout. If you take the current pace and take that as a given, then without an acceleration, you would get to the wrong calculation for the speed at which this vaccine is going to be rolled out. But each venue that we open for vaccinations has to be approved, has to be got right. It's very, very important, because you've got to make sure that the vaccine gets into people's arms in a safe way, so that we know that they're safe, but also that the vaccine works. That's why we're not putting projections on these figures, and precisely as you say, to make sure that we only commit to that which we know we can deliver. I don't know if anything to add, Susan?
No, I agree. The sooner we vaccinate people, the better, but it will take some time.
That's right. Thank you very much indeed. Thanks, everyone. That ends this coronavirus briefing. And the final thing to say is I wish you all a happy Christmas.
Well, a pretty sombre news conference there from the Health Secretary Matt Hancock, who announced that another new variant of COVID-19 has been identified in the UK. 2 cases of this new variant, both of which have been close contacts of those in South Africa. And this new strain of the virus is, in the words of the Health Secretary, highly concerning, even more transmissible. 2 contacts of cases that have travelled from South Africa. Anyone who has travelled from South Africa in the last 2 weeks, or is a close contact of anyone who's travelled from South Africa in the last 2 weeks, is now being asked to self-isolate. He also announced more areas of the country moving into the highest level of restrictions, Tier 4. They are Sussex, Oxfordshire, Suffolk, Norfolk, Cambridgeshire, Essex, Waverley in Surrey and Hampshire, apart from the New Forest. Moving up to Tier 3, Bristol, Gloucestershire, Somerset, Swindon, the Isle of Wight, the New Forest, Northamptonshire, Cheshire and Warrington. And moving up to Tier 2, Cornwall and Herefordshire. So no part of the country remains in Tier 1 now. On the good news front, he said that Oxford AstraZeneca has submitted a full data package to the MHRA for approval. Vaccination has begun in care homes, starting with the Chelsea pensioners. But very, very concerning news about this new variant, another new variant identified from South Africa, and suggestions from the South African Health Minister that this new variant more severely affects young people than the previous virus has done. Let's bring in our political correspondent, Rob Powell, who is listening in Westminster. It isn't good news, Rob.
No, I think Matt Hancock trying to bring a bit of festive optimism to that news conference, but it really was sombre on several fronts. In terms of that new strain, that new variant, another new variant where 2 cases have been identified originally from South Africa. The Health Secretary saying that restrictions were now being brought in on travel from South Africa, that quarantine regulations would be brought into law to make sure that anyone who either has that variant or is a close contact of someone that does, or a close contact of someone that's come back from South Africa, is placed into quarantine. The UK, I guess, finding itself on the other end of responding to another international variant that we've seen the responses from other countries towards the UK around the first variant, now struggling to try and make sure that this new variant stays under control. Now, in those questions to Susan Hopkins from Public Health England, she was asked whether there was any indication that the vaccines that are being approved would be ineffective against this. She said that the evidence as it stands at the moment is that they would expect the vaccine to work against this South African variant as well. But I think incredibly worrying that this may be even more transmissible than the first variant that started in the southeast of England. And I think the reason for that was outlined in some of the data that Jenny Harries, the Deputy Chief Medical Officer, laid out, that really shows that if it wasn't for this new variant, then actually cases would starting to be decreasing and the whole country would be in a lot more stable position. She showed some graphs that compared the trajectory of the original variant, if you like, to the trajectory of the new variant. And it really showed that the massive increases in infections we've been seeing recently are being powered by this new variant. Matt Hancock saying as well that the 3-tiered system that we've been living with now was designed around the original variant, the original type of virus, and that actually those 3 tiers were not enough to contain this new variant. I think what might worry people more, though, is that when I asked the Health Secretary how confident he was that tier 4 would bear down on this virus, he said that it will do as much as reasonably possible. So hardly a ringing endorsement, but many people finding that on Boxing Day they will be waking up under a very different set of rules.
Rob Powell in Westminster for now. Thank you. This is Sky News, and coming up in the next hour, another new variant. The Health Secretary says 2 cases of a new, more transmissible variant of COVID-19 have been detected in the United Kingdom. This is Sky News with me, Sarah Hewson, coming up at 4 o'clock. Another new variant. The Health Secretary confirms 2 cases of a new, more transmissible form of COVID-19 in the UK.
Both are contacts or cases who have travelled from South Africa over the past few weeks.
Vital that we act. Large swathes of the east, southeast and southwest are placed under Tier 4 restrictions as cases continue to soar. Vaccine hopes. AstraZeneca submits its data for the Oxford jab for approval. edging towards a deal. Downing Street says a post-Brexit trade agreement could be just hours away. And tensions spill over in Dover as lorry drivers begin to get tested for COVID. Good afternoon. In the last hour, the UK has confirmed 2 cases of a second, more transmissible variant of COVID-19. The new variant, linked to South Africa, led the Health Secretary Matt Hancock to place immediate restrictions on travel from the country. Mr Hancock also confirmed that yet more of England will be placed into Tier 4, with cases continuing to soar nationwide.
As part of our surveillance, and thanks to the impressive genomic capability of the South Africans, we've detected 2 cases of another new variant of coronavirus here in the UK. Both are contacts of cases who have travelled from South Africa over the past few weeks. The Chief Scientific Advisor and the Chief Medical Officer and others met their South African counterparts over the last day, and we are incredibly grateful to the South African government for the rigour of their science and the openness and the transparency with which they have rightly acted, as we did when we discovered a new variant here. This new variant is highly concerning because it is yet more transmissible and it appears to have mutated further than the new variant that's been discovered in the UK. We've taken the following action. First, we are quarantining cases and close contacts of cases found here in the UK. Second, we're placing immediate restrictions on travel from South Africa. And finally, and most importantly, anyone in the UK who has been in South Africa in the past fortnight, and anyone who is a close contact of someone who's been in South Africa in the last fortnight, must quarantine immediately. By quarantine, I mean they must restrict all contact with any other person whatsoever. We'll be changing the law to give this legal effect imminently. Now, these measures are temporary while we investigate further this new strain, which is shortly to be analysed at Porton Down. And I want to thank everyone involved for the seriousness with which I know that they will take these new instructions. We know that the 3-tiered system worked to control the old variant and is working now in large parts of the country, especially in northern England. But we also know that Tier 3 is not enough to control the new variant. This is not a hypothesis, it is a fact, and we've seen it on the ground. We've seen case rates rise in some of the places close to where the current Tier 4 restrictions are, in places like East Anglia, where we've seen a significant number of the new variant, and we've seen case rates rise sharply. It is therefore necessary to put more of the east and southeast of England into Tier 4. We're also taking action in parts of the southwest, where there are some early signs of the new variant and where cases are rising. Even though case rates in some of these areas are not as high as they are in the areas badly affected, in London, for instance, and in Kent, the direction is clear and in many cases quite stark. The doubling times are short. And we have learned that when it comes to being a matter of when, not if, we take action, it is better to act sooner. So from 1 minute past midnight on Boxing Day, Sussex, Oxfordshire, Suffolk, Norfolk and Cambridgeshire, those parts of Essex not yet in Tier 4, Waverley in Surrey and Hampshire, including Portsmouth and Southampton, but with the exception of the New Forest, will all be escalated to Tier 4. Bristol, Gloucestershire, Somerset, including the North Somerset Council area, Swindon, the Isle of Wight, the New Forest and Northamptonshire, as well as Cheshire and Warrington, will all be escalated to Tier 3. And I'm afraid that Cornwall and Herefordshire have seen sharply rising rates and need to be escalated to Tier 2. This is not news that anybody wants to deliver, and I am truly sorry for the disruption that it causes. But I think people know how important it is that we take decisions like this to keep people safe and to protect the NHS.
And this afternoon, the R number range for the UK was revised. It is now between 1.1 to 1.3. That is up from 1.1 to 1.2 last week. Our science correspondent, Thomas Moore, joins me now. So news of another new variant which is highly transmissible, more transmissible than the previous variant, Thomas. What can you tell us about it?
Well, we know that this variant emerged in South Africa. It shares some of the mutations of the other variant that we're just getting to grips with here in the UK. They overlap, but these viruses did evolve separately. So this seems to have come from South Africa, and it has, they think, been driving the surge of infections in that country. That it has a higher transmissibility rate, so it spreads more easily from person to person, but it seems to be affecting younger people to a higher degree, and that will cause a concern, because of course we are directing the vaccine at the old because they are thought to be more vulnerable in this country. So if this does take off, and it's a big if at the moment with the restrictions that Matt Hancock unveiled there, clearly trying to shut it down. But if it does take off, then it will be a significant concern. I think what is now being attempted by the government is to shut this down before it even gets a grip in the country. That if there are just a handful of cases, that those should be able to be contained or certainly slowed while this vaccine is being rolled out. And that is the big question here. How quickly can the vaccine be rolled out to protect those most vulnerable when you have got this virus, which it's really playing cat and mouse with the scientists now, and it is evolving, clearly evolving, and that is going to potentially cause problems. Maybe not with the vaccines yet, but potentially, if it continues to mutate, that will be something we have to get to grips with in the coming weeks and months, and perhaps redevelop booster doses for people in the coming years.
OK, Thomas, thank you. Large swathes of the east, southeast and southwest of England are to be placed into Tier 4, the highest level of COVID restrictions from midnight on Boxing Day morning. Live to Westminster and our political correspondent, Rob Powell. And this in reaction to a surge in cases in those areas, Rob.
Yeah, the concentration of tier movement being in the southeast, around London in the southeast, the existing tier 4 areas. So the list being Sussex, Oxfordshire, Norfolk, Suffolk, Cambridgeshire, the rest of Essex, Waverley and Surrey and Hampshire, including Portsmouth and Southampton, but not including the New Forest. They're all moving into tier 4. That takes effect from Boxing Day. So in those areas, the Christmas bubble rules of mixing just on Christmas Day will remain according to the tier they are in at the moment. Also moves as well into Tier 3 and Tier 2. Into Tier 3, we see Bristol going. Now, Bristol just days ago moved from Tier 3 into Tier 2, has been there for a matter of days, and now is going back to Tier 3. Gloucestershire, Somerset, including North Somerset, Swindon, the Isle of Wight, New Forest, Northamptonshire, Cheshire and Warrington as well, all into Tier 3. So that's the Isle of Wight going from Tier 1 to Tier 3. And then into Tier 2 is Cornwall and Herefordshire. Herefordshire was placed into Tier 1 a matter of days ago, so it spent days in Tier 1 with things like pubs and restaurants able to fully open for a matter of days before they're having to go back to doing meal service if they want to open. All of this coming in from Boxing Day, which I guess begs the question that if the situation's grave enough in some of the areas going into Tier 4 for it to go into this top category, is it really wise for people to be mixing on Christmas Day? On that, Matt Hancock really just trying to bolster up the tone and the language, saying to have as fewer contacts as possible. Now, of course, the reason why this is all happening, as laid out in some of the data that we saw in that press conference, is because of the very big impact that this new variant, and I say that's the original new variant as opposed to the South African variant, the impact that is having on infection rates. Some very stark numbers from Matt Hancock saying that infections have gone up 57% in a week, and that the 3 tiers that they'd initially constructed aren't enough to control this new variant. And that is why we are seeing places rise up through this tiering structure. But I think it begs the question, if the 3 tiers aren't enough to control this new variant, how long before the whole country ends up in the top tier?
Rob, thank you. I have more grim news to bring you now, and that is the government data on coronavirus in the UK that has just been published. 39,237 cases were recorded on Wednesday today in the last 24 hours. That's up from 36,804 the previous day. In terms of the number of people who have died within 28 days of a positive coronavirus test, that figure also sharply rising, 744 deaths recorded in the last 24 hours, up from 691 the day before. Let's speak to Dr. Kit Yates, Senior Lecturer in Mathematical Biology at the University of Bath. Dr. Yates, thanks for being with us. The bad news just keeps on coming, doesn't it? And just as we're starting to get our heads around one new variant, we are told about another one. How concerning is this news about the South Africa variant?
Yeah, of course it's worrying. Typically, there are three things that we think about when a new strain emerges. Does it transmit more easily? Is it doubling time faster? Does it cause worse health outcomes, higher hospitalizations, higher fatality rates? And could it evade the current vaccines that we've got? The evidence at the moment suggests that certainly this the new variant, the B117 that we have in the UK, is more transmissible, maybe around 70% more transmissible. This new South African strain also sounds like it may be even more transmissible than that, but the consensus is yet to be arrived at. But in terms of the other 2 points, does it cause worse health outcomes? There's no suggestion at the moment that that's the case, and there's also no suggestion that it's capable of evading the vaccines we got. So there is some positive news to take from this.
Yeah, I was just reading remarks from the South African Health Minister, who was issuing a warning to young people that this does seem to be affecting younger people to a higher degree than the original virus. Others suggesting it's too early to know, but that would be a concern, and that would also potentially impact government policy when it comes to schools and universities returning in the new year.
Of course, it would mean we'd have to think really hard about how and when schools go back and the measures that we are going to take to try to make schools safer. Of course, the government are talking about doing mass testing to try to make sure that we isolate people who are positive. But there are lots more things we can be doing with schools in terms of ventilation, potentially providing winter fuel budgets to mean that schools can have their windows open and still keep their children warm. Things like potentially asking children to wear masks in the classroom as well as just in corridors, and trying to expand the space that we've got in schools so that we can have students as socially distant from each other as is possible to try to reduce the spread in schools, especially if this new South African variant is more dangerous to children.
Given what we are hearing, given the number of cases we are now seeing each day, are the restrictions that are being put in place, more coming in on Boxing Day, are they going to be enough to try and keep control of this?
It's really difficult to know. Like you said, there are 37,000 cases yesterday, 39 today, which are both record numbers for reported cases. Again, for this second wave, we've had record numbers of deaths reported over the last couple of days. The situation is pretty bleak. We don't know enough about whether Tier 4 is going to be enough to control cases. We just haven't had enough time to assess that. But I thought it was interesting to hear Matt Hancock say that he thought that there was no need to put some areas with lower case rates into Tier 4 yet, because the tiers were enough. The tier that they had at the moment was enough to keep control of the spread, in the same breath as saying that actually Tier 3 was not enough to control the spread of this new variant. It suggests that actually, the regions which have low case numbers of the new variant at the moment, they will continue to rise, and actually action needs to be taken there. And one thing that we've learned from this pandemic and our response to it is that fast and decisive action is always paying dividends. And so if the virus is spreading as fast as it is, it makes sense for us to take action as soon as possible and as strongly as possible in all these areas. Now is the time for the government to be brave and to make unpopular decisions and to lead. In short, now's the time to act, because for many it's going to be too late if we wait.
OK, Dr. Kit Yates, thank you very much indeed for your reaction to the breaking news in the last hour. Let's just remind you of those figures that have just been published. 744 COVID deaths in the UK in the last 24 hours. That is the highest number since April the 29th. 39,237 new cases recorded in the UK in the last 24 hours. That is the highest number on record. Well, let's move on now to talk about Brexit and discussions underway, continuing. There are reports that the EU and the UK are edging towards a post-Brexit trade deal, possibly within hours. An official in Brussels has been quoted as saying an agreement's been done. But Downing Street sources insist talks are still ongoing. The transition period ends on the 31st of December. Sky's Michelle Clifford is in Brussels for us. Have they or haven't they done a deal? Can you give us any indication, Michelle?
It sounds very much like they are going to do a deal. An EU official telling me this evening that we are in the end phase of a deal. Hasn't been done yet. They're still negotiating. They've been pushing it right up until the very end, but it really is now sounding very, very promising. And I think a big factor this week is that we know that the President of the European Commission, Ursula von der Leyen, and Boris Johnson have been in regular contact, talking over the phone on the thorny issues that are still outstanding. We know that fishing has been taxing the two sides of the channel right up until the very end. But we think that they are getting there. Some sources have indicated that a deal could be announced in the next few hours. But remember, it needs to be signed off by the EU 27 leaders. It needs to be ratified by the European Parliament. That will take some time. So what we're expecting is, if there is a deal announced, then there'll be what's called a provisional application of the deal, and then MEPs will get to ratify it in the new year. Of course, as you mentioned, the transition period ends on the 31st of December. But of course, the devil will be in the detail. We understand now the legal documents enveloping this whole agreement run to something like 2,000 pages, and they will need to be scrutinised. Everybody will be looking to see, what did the EU give on fishing? What did the UK give on the level playing field? That kind of thing. But after 9 months of torturous negotiation, when very often on both sides people indicated, or sources indicated, that a deal